I'd like to thank the European Connected Health Alliance for this opportunity to present Assesspatients, which is a secure, collaborative platform for health and social service teams to work with the older community to improve the quality of care. I think we're all very, very aware of the increasing trends in ageing population, and with that, the massive increases in demand for both health and social services needs. So what we're starting to see now is best practice, which starts to focus and emphasize the whole idea of an integrated health and social services care approach to provide a more holistic approach for older people. And also one that points to early intervention for all the right reasons. Let's not wait for a major life-changing incident to happen to an older person. Let's be more proactive and maintain or even improve their quality of life. These are all very noble, sensible sentiments, but there are challenges to making them happen. And even in countries that have started down this path, there are interesting lessons to be learned. And in a very much a lean startup approach, that's what we at Assesspatients have focused on initially before any software development, is talking to care professionals in different disciplines to understand what those challenges are. An integrated care team just doesn't happen in one place. If you take health services and social services, they work from different organizations. And even in those countries where they've started to integrate it, there's a lot of teething pains. And even within healthcare, you have different disciplines with different focuses, whether they're physios, speech therapists, doctors, or consultants. And that doesn't even count ambulance and fire services, which in countries like Scotland are taking an increasing role in older care. And then the whole idea about collaboration, it's not simply about repeatedly asking for the same information or even difficulties in sharing information. It's been able to balance kind of care risk assessments around frailty or falls with someone's desire to have a higher quality of life, to be able to be active and social in the community and get the proper balance for that. And then also, as we see in this picture here, it's not about the one location. Preferably, it's about obviously care at home or in the community, but hospitals and residential care homes also have an important role in terms of rehabilitation after an incident or step-up care. So how can we improve the collaboration in that instance as well? And then also about early intervention. What we want to get to is that where a person of any age nearly goes to see a clinician or healthcare or social service person, that there can be a number of screening methods carried out that may then provide online alerts to other members of a care team for immediate or more medium-term action, again in the interests of early intervention. And above all else, and in terms of the other 3 points, there's cost effectiveness, and that's the same whether it's public or private healthcare. With this in mind, we've built 3 components. First of all, on the left-hand side, we want to facilitate the interaction between the care team and the older person, assessing a range of needs according to the integrated care platform. So whether that's physio, frailty, dementia, pressure ulcers, whatever the care platform. And then ally that with a series of outcomes to really focus on the quality of life, and then build a series of personalized online alerts to keep all members of the team in the loop on any changes in the person's condition. And then, basically, as I said, with outcomes. And then also we have the older person very much at the center. And apart from the face-to-face contact, which we want to emphasize and build the quality around, we want to facilitate them through a simple mobile app to give updates on their outcomes and activities, again feeding into the progress of their plan. And then the final, and potentially very important, is support care program managers to be able to get intelligent metric-driven dashboards that focus on care governance, care team effectiveness, the person's experience, as well as financial effectiveness. So essentially what you see here is John and Mary leading a very active life through their extended family. And what we're focused on is making their other family, the care team across all the disciplines, collaborate and work effectively with them for a higher quality of life. All our information is at assesspatients.com. We're very interested in working with partners to make sure we can provide that holistic care approach for older people. And to that end, we have a lot of APIs developed to security pass information to and from, because we appreciate when you're trying to bring social services and healthcare together, it involves a lot of different systems. Finally, I'd just like to see, looking at the companies that are in the showcase both today and tomorrow, I think one of the really interesting principles you see is the whole focus is around improving the collaborative relationship between the healthcare, the clinician, and the person, which is really good. Thank you very much for your time.